The mountain of surging COVID-19 cases and deaths in the U.S. is calling attention to the molehill of flu-related activity. KQ2's Matt McLean with more on this bit of good news emerging this winter.
Public health experts feared a potential twindemic, of both flu and coronavirus cases surging at the same time, creating an impossible situation for hospitals.
We had 2 drive-through clinics on Saturday mornings. I believe we had over 100 children vaccinated in both of those events. So we still have a lot of parents very interested in the flu vaccine.
Overall, the U.S. has seen lower flu activity than what is typical this time of year.
So far, Peacock Pediatrics has not actually seen any positive cases. We have tested symptomatic kids, but so far we haven't had anyone turn up positive.
And in the southern hemisphere, where the flu season stretches from June to August, widespread lockdowns, hand washing, and other precautions against COVID-19 drove flu down to record low levels.
I still think it is a little too early to tell, but I think with the coronavirus, people are being more aware, they're being much more careful. So I feel like more people are staying home if they don't feel well, whereas, a year ago, they may have not thought twice about going to the grocery store. People are doing a better job washing their hands.
Signaling potentially good news.
But we're not doing a great job at social distancing always and some of those things. So I think we need to be careful because it could kind of sneak up on us.
Another complicating factor is that Peacock Pediatrics has had more parents this year ask whether the flu shot is even necessary, given the prevention measures they've been taking.
We don't know what kind of flu season we're going to have. Just because it's had a slow start doesn't mean we're not going to have, just as bad a flu season as we've had the last couple of years.
So the answer to the question is yes, it's necessary. It was necessary last year, it's necessary this year, and it'll be necessary next year.
This is still very early flu season, so the sooner the better, because it takes around 2 weeks for our body to build immunity from the flu vaccine, so you want to get it sooner rather than later.
Reporting, Madeline McLean, KQ2 News.
According to state data, so far the flu season this year has only been 1 flu-related death. At the same time last year, there were more than 300 flu-related deaths in the state.